Please welcome Dr. Mallory O'Brien, Associate Scientist, Center for Gun Violence Solutions at the Johns Hopkins Bloomberg School of Public Health, and Malcolm Cunningham, Bloomberg Fellow, Gun Violence Review Board and Director, City of Toledo Mayor's Office of Neighborhood Safety and Engagement, with Mark Talbot, Chief of Police, City of Norfolk, Virginia, in conversation with Chip Brownlee, reporter at The Trace.
Good afternoon, everybody. Thank you all so much for being here. I have been working at The Trace for the past 4 years covering gun violence. I write a lot about solutions to gun violence, and even though I do this every day, often I'm surprised by some of the solutions that I come across and really excited about things that we can work on. Violence reduction councils are one of those things. Mallory, you and I have talked about this before, so I want to go to you first. Can you just give us kind of a high-level overview of what violence reduction councils are and kind of how we got to this?
Sure, thank you. So violence reduction councils really are based in public health practice. The first violence reduction council was established in 2005 in Milwaukee, Wisconsin. It was called the Homicide Review Commission. And early in the days of the Homicide Review Commission, there was an evaluation that was completed that showed that in the districts that participated in the review process, there was a 52% decrease in the monthly counts of homicide compared to a 9.2% decrease in those not participating. So very quickly we went to looking at cases across the entire city. That was the very first Violence Reduction Council. Fast forward 20 years, and we're now in the next generation of homicide review, which is violence reduction councils. And we have been building out training and technical assistance on violence reduction councils based on lessons learned from communities across the country. What is a violence reduction council, which is really your question? A violence reduction council is really a framework for communities to think about how do we prevent gun violence. It's bringing together multidisciplinary agencies and entities to share data and information through a case review process that allows them to see what were those missed opportunities for us to work together and collaborate. And the components that I think are key for a Violence Reduction Council are having the right people in the room, having the right agencies in the room, having them really sharing not only their data, but information on how their agencies work, and how you in your own agency can see how you can leverage and work collaboratively with the other entities. Mm-hmm. The second thing I think that is really important is having really good data. And so if you think about public health, criminal justice, behavioral health, community-based organizations, community members that are participating in a review, you can imagine the magnitude of data that would be shared on a particular case. So being able to capture that information is really important, and so having a robust data infrastructure that underpins a violence reduction council is very important. And then the last thing I think that's super important is having accountability. So having some accountability through having frontline individuals, mid-level management, and executive leadership engaged is critical, I think, to a successful violence reduction council.
Yes, thank you so much for that. Chief Talbot, I want to come to you next. Violence reduction councils are really something that is implemented at the local level. And in Norfolk, y'all have had a homicide review commission, which is basically another name for the same thing. Can you kind of walk us through how y'all got that started and what kind of progress y'all have seen from that?
So I think the first thing that we had to do, given the somewhat anti-intellectual bias that policing can have, but that's okay because so does half the country.
No comment.
We had to get to the point where we're willing to think more completely and with more precision about what's driving crime. If you're, in other words, if your model gun violence is it's all about bad guys or girls with guns, you ultimately don't get to the complexity that you need. So injecting ideas into the organizations that I've been a part of, talking about things like economic deprivation and marginalization and the impact in some communities of the compounded suffering, and how it's those communities that ultimately are generating a disproportionate amount of the violence. Once you start to look at public safety through the lens that allows for that complexity, now you can overlay a strategy similar to what was described and move the organization and move the city forward in reliable ways. So that's been really effective for us.
Could you talk a little bit about collaboration? Because one of the things I've talked to people working on gun violence in communities across the country, and one of the things that always comes up is, people often feel like their work is in silos, or they're, doing something and they don't really know what the organization down the street is doing or what the police department is doing. Has the Homicide Review Commission, has that helped y'all kind of break down any of those silos and work on collaboration between the police department and other stakeholders?
It absolutely has. Policing, again, can be a closed society, and in the closed society that it tends to be, the language and the ideas aren't necessarily conducive to having great partnerships. You might not be surprised to know that we're not great hosts all the time. So having a structure and stakeholders that are sitting with us at the table and adding new language and new ideas has been very helpful.
Malcolm, what are y'all doing in Toledo? And could you talk to us? I imagine setting up a strategy like this can be difficult, and there's probably challenges that you encounter in doing that. And could you talk a bit about the technical assistance aspect of this and what you've learned from your work in Toledo?
Yeah, absolutely. We've received extensive technical assistance actually from Dr. O'Brien was standing up a Violence Reduction Council in Toledo. So she's come on the ground, she's met with us bi-weekly for the past year or so, and has been able to provide us guidance with setting up that data system that underpins everything, with determining who the right people are to be in the room with you, those key stakeholders, and has just been an incredible resource throughout. So it's just been really critical to have her on board and to have the support of the Bloomberg American Health Initiative.
Thank you. Fundamentally, I think what everyone's trying to do is serve the community, right? I mean, at the end of the day, the point behind the Violence Reduction Council is to reduce violence. And I'm wondering, what kind of feedback have you all gotten from the community stakeholders that you're working with? I don't love the word stakeholder, but all the other organizations that you're working with, the people on the ground in the communities that are most affected by gun violence. Have they given you feedback about this model, and what have you learned from that? Mallory, do you want to maybe start? I know that y'all did some feedback in Milwaukee.
So what we found, there are challenges. Information sharing is one of the key things that teams struggle with. But everybody that has participated feels like there's value in being in the room together. And even if you don't have every agency sharing information, getting them in the room and hearing the same thing at the same time and having them be part of the solution, people really appreciate having that ability to help drive some of the strategies. And they also appreciate that something is actually happening, that they see movement, that the strategies that are identified and developed are actually being implemented.
Malcolm?
And with us, we know that lived experience is expertise. We also know that communities are often exhausted by planning, by meetings, so they've been able to engage and see that there is actual progress on the recommendations and that there's a willingness to convene across these different stakeholder groups. We have grassroots folks that have been on either side of the gun. We have the police chief that's involved. We have our public housing complex. We have all of these different stakeholders that are just willing to support and engage. So they're excited about it. They're willing to move forward, and they want to see actual action happen. So
I'm curious if you have any thoughts on how you make sure you have follow through on the action aspect of things?
Shared accountability in a public setting and having a return to whatever those goals and those recommendations are. So that's really the key for us.
Chief Talbot, do you have any feedback?
Having having somebody at the table who is typing minutes and is helping to track agreements so that the folks who say that they're going to do something actually do it. I think very often our strategies and our approaches to reducing gun violence fails in the most mundane ways possible. You just didn't knock on the door. You didn't actually do the interview. You didn't actually build the relationship or follow through in that particular neighborhood, and it was simply a failure to honor one's word.
Mallory, really quickly, could you tell everybody, y'all have a toolkit that people can access to learn more about violence reduction councils. How can they find that?
We have just Google Violence Reduction Council. But it was funded through the Bloomberg American Health Initiative. It's a toolkit. We have training. We are supporting communities across the country. So if anybody's interested, reach out. But one of the things that's been really exciting is that because we've been doing this work now for some time, we were just awarded a grant from the U.S. Department of Justice to use the Violence Reduction Council model to look at multiple casualty shooting events that are occurring in our cities across the country. And looking at the intersection of these multiple casualty events and community violence intervention. So we will be piloting that in 5 communities across the country.
I think that's a great note to end it on. Thank you, everybody.